A very good evening. My name is Dr. Satveer Singh, and I am a consultant surgical oncologist, laparoscopic endoscopic surgeon. To start with, I did my residency from Maulana Azad Medical College, where I did my residency. Following that, I did my training in robotic surgery from Max Super Specialty Saket. Following that, I did my fellow in surgical oncology from Tata Memorial Hospital. I have keen interest in treating surgical oncology patients, and apart from that, because I did residency from the esteemed Maulana Azad Medical College, I have been doing a lot of surgical gastroenterology work also, and I work in a tier two, tier one, tier two city of Hazaribagh and Ranchi, where I get a lot of gastroenterology patients, and I do endoscopy and colonoscopy for them. So within recent times, we have seen that there is a lot of GERD, gastroesophageal reflux disorders, among all the ages of the population, starting from the even from the pediatric age group up to elderly. And this has been increasing day by day, year by year, and now using of PPI has been like a pop-up pill. So taking care of this disease, or especially this gastroesophageal reflux disorder, where everyone complains, I feel heaviness in the chest, jalan hoti hai, I feel the pain. And if I talk about the pediatric age group, the pediatric age group, which is very difficult to diagnose GERD because it was very uncommon, but now it has become very common. So the child keeps on spitting. Whatever he eats, he cries a little bit and he vomits. All these symptoms are symptoms of GERD, and it is very important to control these symptoms in pediatric age group in GERD for those group of patients. So, for foremost, there are three forms of treatment in GERD. First is diet modification. All the forms of junk food, fried food, packed chips, chocolates are avoided in all these forms. Less use of screen because of the blue light effect on the brain, which also causes reflux. And doing because now most of the kids are sticked up to the screens, either from their phones or either from or their TV screens or iPads. So to separate from those things is very important, and let the child do the physical activity, which is foremost thing for this, and avoiding all forms of fatty foods, saturated foods, like all fast foods, and we should switch over them to more and more of a healthy greeny leafy vegetables. So all these things are incorporated among treatment of GERD and use of some form of PPI for those pediatric age group. And I also recently, few days back, I had a beautiful discussion on GERD in pregnancy also, because this is also a form when, if the mother is suffering from GERD, there are chances that the pediatric age group patient or the infant will definitely suffer from that disease because that mother had that problem. So I will suggest, before, if you have any form of a gastric disorder or a mortality disorder, before starting your pregnancy or before planning your pregnancy, it is requested to please get a proper treatment for that. And you won't mind if a proper 4 to 6 weeks of a proper treatment for GRD can cure it, unless and until it is delayed from a very long. So if there is a recent attacks of GERD, a 4 to 6 weeks of treatment of GERD using any form of a PPI, or now we have a newer forms of drugs like potassium channel blockers, venoprazan, which are being used for controlling of GERD, and they are giving promising results. Yet has to come, but we don't recommend those in pediatric age group or in pregnancy, but in adults and elderly group we are promoting that, and which is very helpful. And basically three things has to be done. So if any age group of a person is having GRD or nocturnal reflux, what will be those symptoms? Patient will be telling that at night he has severe cough, or breathing difficulty. In the morning time, patient have uh, a bitter taste in the mouth. Their throat is always burning. So all these symptoms are all these features are the symptoms for GERD, and for them we should first give them a inclined support. So we have inclined pillows now available for GERD, and use of those inclined pillows do help them a lot. And the next part is getting done a proper upper GI endoscopy. So upper GI endoscopy plays a vital role in diagnosing GERD, because it's just not GERD, it is also the pylorus, which is edematous, and it is not functioning properly because of the ulceration of preparlytic edema. And treating that pylosis or doing endoscopic dilatation for the pylorus also prevents formation of GERD, and all the results are very, very good. So that's all. And the other forms are that the biggest problem these days, most of the parents tell that the kid does not eat. They forcefully feed them, either by sitting, making them the mobile on, or the screen on, or the cartoons on, and then let the and feeding the baby at then. Most of the parents tell that their babies does not eat on that. So if while you are having a meal and your complete senses are not at present, your mind is busy with something else, the complete digestion process which goes from the brain to gut is not complete. And this disruption of this brain gut axis is the leading cause of all these gastrointestinal disease form in their children. So healthy habits should be inculcated. All the screen time should be given in an awarded form. If you say that if you eat your food well, then I will allow you to use this screen for this much amount time in like a gift, or it should be in value to that, and then those things should be done. And if it is completely freely given to them, then they are addicted to that, and you cannot stop them, because these cartoons or these things are so much addictive to child's brain. They do not want to leave that, or if you take it away, they show all forms of tantrums and child and behavior. So this proper maintaining of child psychology, taking time by both of the parents for giving some kind of a activity form, playful form by either of the parent or the grandparents or the people, and making them indulge in all the physical forms to take out, channelize their energies. And so if the kid is channelized by this energy, then the kid will be hungry, and if he is hungry and you don't need to gulp in all the food, he will eat whatever he. ठीक है, we need to take care of his anemia status. They need to take care of his nutritional status by giving them some form of multivitamins, and then the growth and will be very good, and this GERD will not be present among the pediatric age. I think that will be all. Thank you very much for your patient listening. Another form we will talk about GERD in elderly patients. So especially these are those age group of patients which are diabetic and hypertensive. So in those form, what they do is they are always burping and always popping up gas pills. Either form of they say कि sir हमने pantoprazole खा रहे हैं, हम ये खा रहे हैं, वो खा रहे हैं, and they use it in a very irregular form of fashion. So for all those group of patients who are suffering from this form of a GERD, there should be a proper screening for that. And for all those elderly patients कि सर मुझे गैस की प्रॉब्लम है, द प्रॉपर चेकअप, upper GI endoscopy, pH monitoring, H pylori testing, all these things should be done in a proper way, for so that the main form of the disease is there. I just 10 minutes back I had a patient with a very big file of visiting all the gastroenterologists throughout the country and telling that कि sir मुझे गैस की प्रॉब्लम है, and I'm not able. 3-4 years back, I was diagnosed with H. pylori infection. I said, so do I need an upper GI endoscopy at this moment? I said that upper GI endoscopy is to see that if your stomach or the duodenum is having any form of an ulceration on all. But for that, we can do an H. pylori screening by an antibody form. So we have an antibody form of H. pylori screening. It is just a blood test, and which hardly takes 15 minutes to get the results, and just one drop of blood or serum is sufficient to tell either it is it's a screening form, either it's positive or negative. And if it is positive, we need to do an endoscopy to find out it that it is the reports are correct by doing a rapid urease test in by doing endoscopy, and see how many ulcers are there and treat according to that, especially in areas where people take direct water from underground water without filtering them, are more prone to H. pylori infection as compared to people who take filtered RO water. So having clean water is very important to prevent you from any form of H. pylori infection, and that H. pylori infection should also be eradicated with proper treatment. So we have many forms of, the gold standards is by giving a kit format in which there are multiple forms of antibiotics with a pantoprazole, and we are now having some newer drugs like ribamipide, and venoprazan is also one of the forms. Some forms of um, probiotics which also help us in preventing H. pylori.